Good afternoon. This is Dr. Sutton with MDI Prep with another episode of the high yield information for the INBDE exam. These are the topics. These are the high yield remembered things that you might see on your INBDE exam. Also, just remember, we do have INBDE classes that are starting very soon. We have 20 dentists per class. And if you want a seat in that class, feel free to visit our website at www.mdiprep.online. We also have a three-day high yield review class, and that is typically for those who have already prepared for the exam and they just need a little extra boost. So you can either sign up for the 3-day high yield review exam, or you can sign up for the full class, the 3-month class. So today we're going to be talking about INBDE pathology, remembered question that's on the exam. So stay tuned as we listen to the INBDE pathology regarding sickle cell anemia. All right, let's talk about what you need to know. All right, so this is talking about a common thing that's on the exam. It has appeared several times on the INBDE exam, and it goes a little something like this. They may give you a clinical case, and I'll give you an example of a possible case that they could give you on the INBDE exam. So a 16-year-old girl visited, accompanied by her guardian, to the Department of Pediatric and Preventive Dentistry with a complaint of multiple dental decay. Now, on taking a medical history, the guardian revealed the patient was known to have sickle cell disease. During this actual hospitalization, she's been hospitalized for 3 days. She's been given blood transfusion 4 times, and it's been identified on blood study that she does have the sickle cell disease. When you do an oral examination, you identify that there's a mucosal pallor. There is also some yellowing and some jaundice of the eyes. So what are the questions that they're going to ask you about on the INBDE? They will be sickle cell pathology related. So let's just dive right into it. All right. So the first thing that you need to know for sure regarding sickle cell is exactly what is sickle cell. So sickle cell is basically an autosomal recessive condition. Now, that is some of the genetics that you need to know for the exam. Autosomal recessive disorder. So basically what a recessive disorder means is that you have to have actually 2 copies of the allele. So that means that, for instance, if you think about your chromosomes are in pairs. So if you have, let's just say we're going to say small s, the little bitty small s, represents the sickle cell trait. So if you have 2 chromosomes and both of those chromosomes have the small s, that means you actually have the sickle cell disease. Now, if one of your chromosomes has the small s and the other one doesn't, then that means that you are a carrier or that you have the trait. So you may not show any signs or symptoms at all. So in order to really show signs or symptoms regarding sickle cell, remember it's autosomal recessive. Remember that for the test. And that recessive means that you have to have 2 copies of that allele. Okay, everybody got that? The next thing that you need to know for the test regarding sickle cell is that they may ask you what type of mutation it is. Sickle cell is what we call a missense mutation, And all that really means is that a missense mutation means that in a codon, in an actual codon, there's one base change, just one base change. And when you change that one base changes the amino acid. So in the case of sickle cell, in normal hemoglobin, and let me just go back and say this. So normal hemoglobin would be hemoglobin A for adults, hemoglobin F is like fetal hemoglobin. So in normal hemoglobin, you would have glutamic acid as your amino acid. So glutamic acid. In sickle cell, that glutamic acid is going to be replaced by something called valine, another amino acid called valine. Now you may say, well, what's the big deal, right? Well, here's the big deal. So glutamic acid is hydrophilic. Valine is hydrophobic. Most of your body is water. So now what you're basically doing is you're replacing an amino acid that's hydrophilic with an amino acid that's hydrophobic that doesn't really like water. And so this is going to cause that hemoglobin to sickle. So what's the problem? What happens? So what's the big deal if it sickles, right? Well, the problem is this, is that now that hemoglobin, which we now call hemoglobin S, is not going to be able to carry oxygen like the other hemoglobin, the hemoglobin A or the hemoglobin F. So with that said, then that means if you're not able to carry that oxygen and transport that oxygen to the places that it needs to be, you're going to have problems. Well, what sort of problems, right? Well, the first problem you're going to have, think about this. Oxygen is needed for the tissues. So that way, if you're not transporting that oxygen to the tissues, you may get something that happens, such as bone pain. Bone is a tissue. So if you don't get the oxygen to the tissue, you're going to have bone pain. The other thing, anywhere that you think of where oxygen is needed, if it's not being transported there, there's going to be a problem. The other thing that you'll see with hemoglobin S is that you'll find some what we call agglutination. You're going to basically start to find some of the blood vessels being occluded because of the hemoglobin S. Now, because those blood vessels are occluded, that's going to decrease the blood flow to certain areas. Wow. So if you decrease blood flow to certain areas, you can cause necrosis of that tissue. That tissue can start to die. You can start to get jaundice. You can start to get other things, what we call vaso-occlusive disorders, all because of how this hemoglobin S is behaving. Now, for your exam, remember this. Anytime that they talk about the sickle cell, what they want to know, first of all, if you understand exactly what's happening in a bone crisis, what's happening when they go into a sickle cell crisis. What's happening is mainly what we call a vaso-occlusive crisis. Okay, that basically means that the blood flow is not circulating like it should. So think about this. If the blood flow is not circulating like it should, including the oral cavity, then you can start to get in the oral cavity a little drier than it needs to be, which can lead to more cavities. So one of the things that you could see in a patient with sickle cell is more cavities. The other thing that you're going to be looking for in terms of sickle cell is some of the other complications that could happen. You could get something called osteomyelitis, which basically is a fancy word for just saying they could get bacterial bone infections. Okay. So for your exam, remember the keys to sickle cell. 1, it's going to be a missense mutation. 2, you're going to be replacing glutamic acid with valine. 3, it's also going to be caused by a single base mutation. It's a single, what we call a point mutation. The other thing that you're going to be looking for in reference to sickle cell is that you're going to have a decreased oxygen carrying capacity in hemoglobin S. Now, with all that said, the other things that you want to keep in mind for your test is that whenever you're looking at sickle cell, the problems with the difficulty with oxygen and the lack of oxygen to certain tissues. Just think of it like this. Whenever they ask you a question, and let me just give you an example of some of the questions they could ask you. 1, they could ask you the genetics. It's autosomal recessive. 2, they could ask you for treatment. Treatment meaning oxygen, that's a key. The other thing too is a trigger. Is there anything that can trigger the sickle cell crises? Dehydration. So you want to make sure that the patient is always hydrated. Those are the basic things that they can ask you about sickle cell. Sickle cell, probably 90% of the test, the INBDE exams that have been given, have had some type of question about a sickle cell patient. Okay. So make sure you understand the genetics. Make sure you're able to identify it. Make sure you're able to know a little bit about the treatment portion, but not too much. Just know that dehydration can trigger the sickle cell crises. So if this was helpful, please leave a like on our Instagram. Also like us on YouTube and also like us on our Spotify. Each time that you do that, we will add another video. And again, if you are interested in actually passing the exam, and guess what? Everyone Everyone has an opportunity to pass the exam. You can pass that exam with the right resources and the right help. MDI Prep is here to help. All right, we'll see you next time.